With bird flu making headlines again, concerns are rising about how the virus is spreading and what can be done to protect families, pets, and backyard flocks. The outbreak, which has been tracked since early 2022, has led to the loss of millions of poultry, soaring egg prices, and now, troubling reports of infections in cats and even dairy cows. While experts reassure the public that the risk to humans remains low, they also stress the importance of taking precautions, especially for those in close contact with birds or animals that could be exposed. Understanding the risks and following expert recommendations will be key to keeping loved ones safe. One of the biggest concerns emerging from this outbreak is its increasing ability to infect mammals. Recent reports of house cats contracting the virus, with fatal outcomes, have raised alarms. Health officials in Oregon confirmed that 2 pet cats died after eating raw poultry products contaminated with the avian influenza virus. And in Michigan, researchers suspect that dairy workers may have transmitted the virus to indoor cats, something previously unseen. While the bird flu virus remains primarily a threat to birds, its spread to more mammals raises the risk of mutations that could increase its ability to infect humans. Past pandemics, such as the deadly Spanish flu of 1918, were linked to bird flu strains, underscoring the need for continued vigilance. For backyard chicken owners, the message is clear: minimize exposure to wild birds and practice good hygiene. Wearing gloves or masks when handling birds, disinfecting coops, and keeping flocks contained can all reduce the risk of infection. While some chicken owners dismiss these precautions, health experts warn that ignoring safety measures could lead to unnecessary risks. If birds exhibit signs of illness, such as low energy, swelling, lack of appetite, or poor coordination, it is essential to report these symptoms to veterinary professionals and avoid handling sick birds without protection. Pet owners also need to take extra care. With confirmed cases of bird flu in domestic cats, the safest step is to keep cats indoors, away from potential sources of infection. Stray or outdoor cats could come into contact with sick or dead birds, increasing their chances of contracting the virus. Additionally, pet owners should avoid feeding raw or undercooked poultry to their cats or dogs, as contaminated food has already led to fatal cases. Ensuring that pets receive veterinary care at the first sign of illness can also help prevent further spread. Symptoms to watch for in cats include tremors, seizures, and loss of appetite, while in dogs, the illness is typically less severe but may include fever and fatigue. On a broader scale, researchers and public health officials are closely monitoring the virus for any signs of mutation that could make it more transmissible to humans. Dr. Richard Webby, a leading influenza researcher at St. Jude Children's Research Hospital, has warned that while the current risk to humans is low, the virus's ability to infect more mammals is a cause for concern. The vaccines developed for bird flu are not widely available to the public, and if the virus were to suddenly evolve into a strain capable of efficient human-to-human transmission, vaccine production would take time to scale up. Preparing now and staying informed about public health recommendations is crucial in case the situation changes. Despite these concerns, experts emphasize that there is no reason for widespread panic. Infectious disease specialists like Dr. Steve Threlkeld caution that while bird flu has the potential to be more dangerous than COVID-19, the virus is still primarily a bird disease, with only rare cases of human infection. The most effective steps for individuals are practical ones: maintaining good hygiene, keeping pets safe, avoiding unnecessary contact with sick or dead animals, and staying updated with credible health sources. While the risk of bird flu becoming a major human health crisis remains low at this stage, history has shown that viruses can evolve in unexpected ways. Remaining cautious without alarm, following expert recommendations, and being prepared for potential changes in public health guidance will help ensure that individuals, families, and pets stay protected.